we're going to knock out another one of these great questions. For this week's Challenge Wednesday, we have our patient Ricky. And Ricky has a past medical history of atrial fibrillation, frequent orthostatic hypotension, and chronic renal failure. The patient is currently undergoing hemodialysis. Which of the following is the least appropriate for this patient? So we have A, exercise on non-dialysis days. B is exercise in the mornings prior to hemodialysis. C is exercise during the first half of hemodialysis treatments. And D is exercise immediately post-hemodialysis. All right, so let's go ahead up to the top. We got our patient Ricky with a past medical history of AFib, atrial fibrillation, frequent orthostatic hypotension, and chronic renal failure. All right, so let's just talk about this real quick. I won't take long. Atrial fibrillation is actually a very common condition in the elderly population or the older population, people that are older than 40 years of age. It's relatively common. All right, it's going to be an erratic quivering of the atrium, and it's due to like all of these electrical impulses that are originating in the atrium. All right. And those electrical impulses shouldn't be just originating out of there and going crazy and causing this erratic quivering. It's not something that should be there. However, atrial fibrillation is a condition that a lot of people live with and live long lives with. All right. As long as it's stable and it's medicated. So right now, we know that this patient has atrial fib. Cool. Now, frequent orthostatic hypotension, the majority of us have seen this time and time again. Am I right? Orthostatic hypotension, that condition of low blood pressure when the patient changes position, usually going from supine to sitting, sitting to standing. All right, we're all on the same page. All right. And then we have chronic renal failure, and that's where the kidneys are obviously not doing their job of filtering the blood. And we know if we're not filtering the blood properly, it builds up with toxins in the bloodstream. And these toxins could be fatal. The things like hypercalcemia or hypokalemia or hyperkalemia, rather. All right. All of these electrolyte buildups or potentially the buildup of uric acid or urea or anything like that can cause fatal damage or fatal conditions for our patients. So we want to make sure that they're being treated. And that's the reason why we see, our patients using this hemodialysis or having hemodialysis treatment. Okay, so as we move down the line, it says the patient is currently undergoing hemodialysis, which makes sense because the patient has chronic renal failure. Okay, cool. Now the question stem, the last sentence of the question says, which of the following is the least appropriate for this patient? So in order for us to get this question correct, we got to know all those different conditions that I was just talking about. But as I look down at our answer choices, we really have to know what should and should not be done with our patient who is undergoing hemodialysis. That's really the question here. So let's look at the answer choices again, and we're going to knock this out quick. A said exercise on non-dialysis days. B is exercise in the mornings prior to hemodialysis. C is exercise during the first half of hemodialysis treatments. And D is exercise immediately post-hemodialysis. All right, so let's look at the first one, exercise on non-dialysis days. Now, let me ask you this. Regardless of whether your patient has AFib, orthostatic hypotension, chronic renal failure, should the patient keep exercising, or do you think that the patient should completely just stop exercising? You know what, Ricky, because you have chronic renal failure, I don't ever want you to exercise again. You just sit in that chair and stay there. How does that sound? That don't sound right? Okay, so we can already say just from what we know about exercise that it does have benefits regardless of where you're at in your life, right? Regardless of the conditions that you have, exercise has those benefits. So the fact that it says exercise on non-dialysis days, that's okay for this patient. It's indicated they should be doing that. All right. And so because the question is saying which of the following is the least appropriate for this patient, I'm going to go ahead and just scratch out A. Are we on the same page? We good? All right, let's look at B now. It says exercise in the mornings prior to hemodialysis. So really we're asking the question of, can our patient who's undergoing hemodialysis exercise in the mornings? Now, the answer to that is yes. All right, you can exercise in the morning. All right, and part of this may be like, oh, well, maybe you don't want to exercise in the morning because it'll fatigue the patient or something like that. But in really looking at the whole scope of this, that's not entirely true. Would you fatigue them out? Potentially, if your exercise was too high of a degree. Maybe if you're doing really vigorous exercise prior to hemodialysis, that wouldn't be recommended. But just exercising in the mornings by itself prior to hemodialysis, that's not a contraindication. Your patients can do that. That's not necessarily setting them up for anything particularly negative. Again, if you were exercising them outside of their capability, all right, doing a lot of vigorous exercise prior to hemodialysis, that's a different story. But the question doesn't say that now, does it? All right. And so, again, the question's asking which of the following is the least appropriate. I'm telling you right now, exercising in the morning prior to hemodialysis, that's appropriate. We can do that. All right. So I'm going to go ahead and knock out B right now. So it gets good. We're down to our final two answers. C says exercise during the first half of hemodialysis treatment. All right. Now, this is where it starts to get interesting. Because notice how the test maker has added this answer in there to where it's like, okay, now you're exercising during hemodialysis, like when the patient's actually going through the treatment. Can you do that? The answer to that is yes, for sure. Patients who are undergoing hemodialysis, they exercise all the time during the actual treatment itself. You might say, well, how does that really happen? I'll tell you right now, the most common exercise that's done is some type of lower extremity pedaling while they're undergoing that hemodialysis. All right. Is it the most ideal time? No, it's not the most ideal. The most ideal would be on non-dialysis days. But can these patients do exercise during treatment? Yes, they can. Now, here's the kicker though, baby. When patients are undergoing this treatment, it's recommended that they do it in the first half of hemodialysis treatment and not all the way through and not in the second half. And the reason being is that when you're undergoing exercise throughout the entire time, it fatigues your patient and places them at greater risk for things like orthostatic hypotension. And we don't want our patients having orthostatic hypotension because of why? Those of y'all who are in the car right now, who are lifting the weights right now, why do we not want our patients to have orthostatic hypotension? I mean, y'all tell me right now, what is that reason? And you should be saying to yourself, well, if I leave my patient with orthostatic hypotension, they have a high risk for falls, right? High risk for injury. I don't want that. So we do not want to have our patients exercising in the second half of, or the back half, however you want to say it, of hemodialysis treatment. C right now is appropriate. The patient's able to do it. It's true. But let's look at D and let's see which one is the least appropriate. All right, we'll hold off right now. D says exercise immediately post hemodialysis. And that's exactly what we were just talking about. Because listen, after the patient has undergone this filtration system, right? The filtration system has pulled out quite a bit of things like electrolytes, like sodium. It's now changed their dynamics, their hemodynamics in their body. And so they are now at risk, not just for fatigue. Yeah, fatigue is a big one, but they're now at risk for things like orthostatic hypotension. So to have your patient exercise post-hemodialysis at a point in which their hemodynamics are trying to return back to normal, that is not a great time to exercise. Why? The patient is at risk for harm. I know y'all remember from school, do no harm, right? And that's exactly what we're talking about here. We don't want to place the patient at risk for orthostatic hypotension. We don't want to place the patient at risk for falls. All right. So exercising immediately post hemodialysis is definitely the least appropriate exercise for this patient. We do not want to do this. However, the rest of them are appropriate. Let's go over that one more time, y'all. The final answer here is D. that we do not want to exercise them immediately post hemodialysis. But we can do exercise on non-dialysis days. We can do exercise in the morning prior to hemodialysis. And we also could do exercise during the first half of hemodialysis treatment. All right, if you got this question correct, I just want to say congratulations. This one isn't easy, especially if you haven't dove into hemodialysis and when you're supposed to exercise them and when not. This can be a very tricky one, so I get you 100%. For those of you who didn't get this question right, this is one of the areas that could be an NPTE curveball. All right, they kind of throw it at you. And now you got to, are they supposed to exercise during treatment or not or what? So for this particular area, just make sure you understand what is hemodialysis. Why is the patient going through it? What is the exercise prescription supposed to be? I could throw you another curveball right now and ask you, what should the RPE levels be for this particular patient going through hemodialysis? Where do we want them to be? Do we want them to be low, like 6, 7, 8? Do we want them to be up 12, 13, 14, 15? Like, where should they be on the RPE scale? See, that's another curveball that you need to be ready